My name's Ashley. I'm 32 and I'm a medical esthetician at a plastic surgery clinic. I've always been full chested, and then having kids, my breasts went up about 2 cup sizes, and I nursed both my children for 6 months. So I was just really deflated, and I always was full on top. So after nursing, I was really flat, and I wasn't happy with how my clothes were fitting. I just wanted the fullness back. And I work in a plastic surgery clinic, so I was super comfortable with having it done, and I was just super excited. I couldn't wait until, I was sure that I was done having kids, and waiting until I was done nursing, and then I was ready to go for it. I was just afraid that I might have shoulder or back pain, just maybe with the weight of the implant, but after I had the surgery done, I actually felt like my posture improved, which really surprised me, and I was happy that it didn't feel heavy in front at all. So after surgery, I could not pick up my kids for 6 to 8 weeks, which I knew would be challenging. But I do have help at home. My husband helped me, and my mother-in-law helped me for about 7 to 10 days, maybe. But I was still able to interact with my kids. I could still take care of them. I just had to, I was obviously conscious that I just had breast surgery. But I was really able to return back to normal life. My surgeon told me that the Natrelle Inspire Cohesive implant is the gummiest of all the implants. And when I held them on my hand, the Natrelle Inspire Cohesive kept its shape, and it was able to give me the fullness on top that I was going for. Oh, I love my results. I'm so happy that I did it. My breasts are close to the same size they were before, and I have that fullness on top, and my clothes fit so much better, and I have more options when picking swimsuits or tops to wear. I would tell another mom to do her research, definitely find a surgeon that you trust and you feel comfortable with, but to really do it for yourself. It made me feel so much better about myself. It made me feel how I did about my body prior to having kids. And basically I just feel back to normal, and I'm so happy that I did it now, and I'm happy with the look. And like I mentioned before, my clothes fit better. So my kids are definitely an inspiration. When I first found out that I was having twins, I knew it was going to be a challenge. And just, doing the best for them, making them happy, just kind of creating a happy little world for them to live in. And I feel like being the best mom I can be is, it's important that I feel good and confident about myself.
Natrelle Breast Implants Important Safety Information and Approved Uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor. Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. Autoimmune diseases, example lupus and scleroderma. A weakened immune system, example taking medications to decrease the body's immune response. Planned chemotherapy or radiation therapy following breast implant placement. Conditions or medications that interfere with wound healing and blood clotting. Reduced blood supply to breast tissue. Clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.